And Dr. Seeley, you've been among the medical experts calling on regular breast cancer screening to be offered to those in their 40s. What did you think when you heard the latest guidelines?
I was very disappointed. We had been hoping for a change and an update in line with what the American guidelines had done. And so not getting this update and changing was very disappointing. It's going to lead to confusion across the country.
And what do you make of some of the risks the task force outlined, including unnecessary testing, overdiagnosis, and the anxiety that all of that can cause?
Honestly, that is something that we monitor in all the screening programs in the country. We carefully measure how many abnormal recalls, which they have called false positives, and that should really be a manageable level. And this is what we've done in Canada for the last 25 years for screening programs. So it is a risk, and I think women should be aware that they could be recalled for additional testing. But that is something that women tell us they are very willing to do. And most of the time they get reassured by an abnormal finding turning out to be just normal tissue or something that is not cancerous. They would much rather have that kind of harm than the harm of a delayed diagnosis, of an advanced breast cancer.
And so what do the numbers tell us of what the cost will be? And by cost, I mean, you can talk about it economically or talk about it in other ways, the impact on patients. The cost of not regularly screening women at age 40.
Well, I think the first cost is the number of lives lost. And we know that for every 1,000 women screened in Canada, we will save 3 lives, 3 women's lives in their 40s. And if you translate that using modeling data for Canada, that's a whopping 770 women's lives per year that could be lost if we don't screen them. So that's the first cost. And the other one is the cost of treatment. So when we diagnose a breast cancer, not through screening, but because of symptoms, what happens is that they are more advanced stage at that diagnosis. And that means they're much more likely to need chemotherapy, more extensive surgery, and they'll have to undergo treatment for a longer period of time. Unfortunately, that costs millions, and we just completed a preliminary study looking at the cost for not screening women in their 40s and estimated that this would cost the Canadian healthcare system $460 million. So it's a cost to loss of life, but also to our public healthcare system.
All right, so here's a key question. I'm sure there are a lot of women watching who would like to hear the answer to this. When is the right time for someone to ask for a routine screening?
Well, and a one size fits all is not the best approach, because we have some women who are at high risk and they should start screening in their 30s. But for the average risk for women, it should be starting at age 40. At least being invited to a screening program and undergoing the invitation to screen every year, and then continuing on so long as they are in good health. And we would recommend screening beyond age 74 if a woman has a life expectancy of 7 or more years.
There are people out there, as you know, who don't have a family doctor, who probably don't engage the healthcare system very much, particularly when they're younger. How do people find out if they're at high risk?
So this is one of the reasons why starting screening by referral to a program avoids that barrier of waiting to have a family doctor refer. And that's one of the reasons why we've been advocating so strongly to start screening at age 40. But if a woman is at high risk, she needs to be evaluated with her risk factors. And that really does require a family physician to help identify what some of those risk factors are. They might be a strong family history, previous history of a benign biopsy, or other factors like carrying the genetic mutation for the BRCA gene and other genes. And they would really need to be referred in for high-risk screening. This really should be done with a healthcare provider that is qualified. And so this is an issue that we face in Canada, but any woman should be able to get access to screening if she, is eligible. And that would start at age 40 for most women, and it would start even younger for high-risk women. I will also add that women who are not white are more likely to get breast cancer in their 40s. And this is another reason why these guidelines are so problematic, because they don't consider the higher risk of getting breast cancer in the 40s in women who are not white. So Black, Asian, and Hispanic women, Indigenous women are more likely to get breast cancer in their 40s. And right now are paying a penalty of being diagnosed at a more late stage. And that is something we're really trying to avoid.
Dr. Seeley, thank you very much for speaking with us.
Thank you very much for having me.